And welcome everybody again. My name is Melissa Rosenberg. I'm the director of our County Autism Society. Thanks for joining us tonight. And this is our monthly speaker series, and we're very pleased to welcome Dr. Rebecca Landa. She's the founder and executive director of the Center for Autism and Related Disorders, or CARD, as most people know it, at Kennedy Krieger. She's also a professor for the Department of Psychiatry and Behavioral Sciences for the Johns Hopkins University School of Medicine. And her resume is very lengthy and super impressive. And we're really excited to have her here. She got her master's degree at Pennsylvania State University and her doctorate at the University of Washington. She completed her postdoc training in psychiatric genetics at Johns Hopkins. She's the recipient of the NIMH Shannon Award for Excellent and Innovative Research, as well as the Rita Ruddle Prize for Developmental Neuropsychology. Countless awards and recognitions. And as you know, Kennedy Krieger, the CARD Center is so well respected, and many of our families have benefited from the services up there. So with no further ado, to ask Dr. Landa to go ahead and begin. She'll be incorporating questions if you submitted anything as you registered. So we're going to let her get through about a 40-minute presentation. If you have questions, please put them into the chat. And then after the 40 minutes, we'll go ahead and she'll address your questions. Okay, so welcome, Dr. Landa. Thank you for being with us tonight.
It's my pleasure. Hi, everyone. So, let's see here. How is this going to work? Okay. I see. Okay, there we go. So, I just want to give you an orientation to the Center for Autism and Related Disorders, and then I'll tell a little bit about some of the research. So, our vision to develop, implement, and disseminate systems of care to empower achievement and well-being in individuals with ASD and their families. And to that end, the primary thing that we care about is the quality of life and maximizing the capacity and well-being of individuals with autism and their family members. And so, in order to provide the very best possible clinical care, we have a large research and innovation center, as well as when we have findings that seem to have clinical relevance, we want them to be available to people beyond our immediate borders. And so we engage in a lot of dissemination efforts. These are mostly the staff of our center. We are a multidisciplinary center. And I'll tell, oops, what just happened here? Sorry. Both ethnically and racially diverse experts. Okay, first I'm going to talk a little bit about the clinic. So what happens if somebody wants to be seen at the Center for Autism, the way that Kennedy Krieger works is that you go through a central intake department, and once they do an intake interview or questionnaire with the family, then they make a decision on what department the family should be triaged to. So when they make a decision that someone should come to the Center for Autism, we are alerted, and we have our own triage team. And what that team does is that we have many, as you know from the slide that you saw, we have many types of professionals at the center, and I'll tell you a little bit about that in a minute. And we have many different kinds of services. So it's not a one-size-fits-all. We really try to personalize the care that families receive from us based on their needs and what's already been received in the past. And so families will complete some forms online, and then at the appropriate time, they're scheduled for an appointment, at which time there are a few more forms to complete. Then they come in and see the professional, and they get recommendations and referrals. or they may start treatment with us then or later. So in the clinical care arena, we provide diagnosis and treatment, care coordination, and we serve individuals from infancy. So those can be infants from anywhere in the world. When parents have a concern that the baby may be showing signs of risk for ASD, into young adulthood. I will say that we do not diagnose autism in infants because development during infancy is very dynamic, and I can speak more about that later if you're interested. So in terms of the clinical care, I'm going to put the clinical care into 3 categories: medical, mental health, and allied health. In the medical department, we have neurogenetics, and so we have 2 neurologists. One specializes in seizure disorders, and then the other one specializes in general pediatric neurology. She's an MD, PhD, a neurologist and geneticist. We also have neurodevelopmental pediatricians. We also have a pediatrician, 2 pediatricians, a dietitian, a genetic counselor, nurses, and 2 nurse practitioners. We also, in the mental health arena, have psychiatrists, neuropsychologists, clinical psychologists, behavioral psychologists, social workers, and care coordinators. And then in the allied health professional category, we have speech pathologists, occupational therapists, teaching assistants, and special educators. So these professionals come from 15 different specialties. And we also have our administrative and triage team. We have an informatics and biostatistics core in the clinic that I'll tell you a little bit more later about, along with computer scientists and developmental psychologists and early childhood education. So we have 3 sites. We have one in Baltimore near the zoo, and that's our Green Spring site. I always refer to it as the mothership because it's the picture that you see there on the left that has Baltimore written over it. And then we have our Odenton site, which I know is closer to you, but still not in your backyard. And then there's another site. We have 1 floor in a new building that was built down right next door to the main Kennedy Krieger site in Baltimore City. I will tell you that you all know that there is a Kennedy Krieger presence, more than 1 Kennedy Krieger presence in Columbia. One of the sites of Kennedy Krieger in Columbia has developmental pediatrics, OT, PT, speech, and other disciplines as well. We have 2 staff members there on a part-time basis doing assessments, but we do not provide any treatment there. We, across from that building, we are hoping we would have opened that in the fall, but we can't open it this fall because of COVID. I'm not going to go into it, but COVID has altered life for lots of people in lots of ways, but we do hope to open it in 2021. Now, let me talk to you a moment about our clinical services during COVID times. Nearly all of the services throughout the entire institute are being provided telehealth. However, we do have some individuals who are not best served via telehealth who do come on site because there are some families that don't want to come in because they're worried about getting COVID and they don't want to do telehealth. They've decided to defer their appointments. So if anybody wants to have a neuropsychological, this is the time to get it because there's no wait. So I would just advise you to think about that. I'll talk a little bit more about that in a minute as well. So now let me just explain. I'm going to go to sort of the 2 ends of the continuum of age because somebody specifically asked about services for teens, and so I'm going to talk about that. But in terms of infants and toddlers, if a parent has a worry about an infant, we have infant experts. And Those infant experts span a number of different fields. And we're really, actually, to be honest, sort of the world leaders in infancy and risk for ASD. And so, like I said earlier, we're not going to diagnose autism in an infant, but we can help families develop the right interventions to support the infant's development. And also, if the parents wish, they can have their child's name put on the wait list, because we have a variety of really good interventions for children between the ages of 12 months and 6 years. I will just say that this picture right here is taken from an intervention that is an NIH-funded clinical trial where we're looking at an intervention for babies at risk for ASD or social communication delays who are between 9 and 12 months. And so we've gotten so much positive feedback from parents about that sometime in the coming months, we will open a clinical service for what I call old infants, that is babies who are somewhere between 8 and 9 months and 12 months. So there's that. Oh, if you have a toddler that you want to be seen because you're concerned about autism, go ahead and call, because this is another service that we have minimal wait for right now. So that's one of the things that's some real good news. Now, in terms of teens, we have the people in our center who are the most likely to serve the teens are psychologists, physicians, and that includes psychiatrists and developmental pediatricians, speech pathologists, social workers, and occupational therapists. Now, you can see we have 2 different setups for life skills for individuals, teens with ASD. We have one in our site that's downtown Baltimore and one in the site that's near the zoo. The one that's downtown near the main Kennedy Krieger site has a full efficiency apartment. And so that's really great. And we have been providing telehealth life skills intervention, and it has been really wonderful because the skills that the youth are learning in their homes are immediately applicable to their homes. So they're cooking and cleaning and washing dishes and doing the kinds of things they need to do when they leave home in their natural setting. So we do what we call, that is, we like to start the transition assessments early, because as some of you with teens know, that process of transitioning into adulthood is not, it's not the simplest process. And you want to get connected with the right professionals, including the right physicians and so forth. So that's something that you can get your name on the list for that, even if your child seems way too young for that right now. And then the treatment team is speech pathologists, OTs, and social workers. And we have a number of different kinds of services for that. So let me talk for a moment about the intervention for the Life Skills program. This is a program, it's 12 weeks. It's for ages 10 to 18 years. It's co-facilitated by an occupational therapist and a speech language pathologist. It involves increasing performance within functional everyday activities with a special emphasis on underlying motor and executive function skills that support independent living. So executive function, I'm sure you all know what that is, but it's planning, getting organized, focusing your attention, thinking about the consequences of your actions, anticipation, that kind of stuff. Also, specific areas of communication are targeted, including things like when we do these in groups, having a mealtime conversation, serving each other, offering to take someone else's plate to the sink, asking if anyone else wants the last bite of something before you help yourself. These are the kinds of things that can be included as well. And then we also provide the caregivers with feedback and we provide them with training techniques that we use during the session. Some of the examples of some of the things we work on in the life skills program include using and manipulating and handling tools and materials and utensils for functional activities, following recipes and sequencing to complete functional activities, completing self-care and household chores, learning vocabulary and language concepts that are related to daily care activities. And then, as I alluded to earlier, practicing the skills in a group setting and being collaborative. Okay, now, our speech pathologist, I wanted to mention this about the alternative and augmentative communication, because sometimes I think people feel like once a person with autism ages beyond a certain birthday, that not that much can be done to support their communication. That's actually not true. And we have at least 6 experts in AAC. And so they're very well trained in pretty much all of the technology that exists, everything from low tech to really neat high tech systems. And our speech pathologists also provide diagnostic evaluations for use with complex presentations. The next thing I'll tell you about is also offered by a speech pathologist, and it's called Club. And the person who's the primary lead on this, her name is Sharon Conti. I would challenge anybody to find somebody more fun than Sharon Conti. The room where she does most of her treatment, not this therapy in particular, is across from our conference room. And so she usually treats individuals with ASD all day long. And I can hear her laughing her heart out in there and the kids having a great time. So this is a program she only offers in the summer right now. And it's great because it's literacy, and which we all know can be really tough for individuals with autism. And so this year, there's groups, every year we have groups for elementary, middle, and high school students. And you do not have to be proficient with language in order to be in one of these wonderful groups. And at the end, at least in non-COVID years, we have a huge celebration. And but this year there are 5 groups for teens and preteens. I want to just let you know. Now, we also have a psychologist who offers a 16-week social skills group that is called Ready. It's relationships, emotions, and dating for youth. And, you know, things are talked about in there that need to be talked about in this age range, and but in a way that is very appropriate, and parents can get all the information they want about this program so they know what their child is learning about, so they can reinforce it and handle questions about it at home. This is, however, for youth who have cognitive and language abilities that are in the average range, and we only offer this at our Green Spring campus, the one that's near the zoo. Okay, now we have 10 other social skills groups that we run throughout the year, and they're for various language and social developmental levels, ranging from severe language impairments to above average language. And in these, we use a variety of evidence-based strategies, including video modeling and role playing and social coaching, and there's parent training involved, and we offer these all year round. I did get an email from someone in Howard County saying how much they valued various social skills programs, including Dr. Yoon's program. And she asked me to tell you to get your name on it, on the waiting list, even if when you get called, you're no longer interested. So I'm doing that for you. Okay, now I'm almost finished with this part of the presentation, and I just want to say that every year parents ask us, how can we help? And sometimes I bump into families in the grocery store and they tell me about how their child's doing, and I get invited to the wedding sometimes, and it's just so awesome to see how life unfolds. And so we have this group that was started by some parents of individuals with autism. It's called Friends of Card. And we every year we have at least one event, and it's always free. And it's just fun to be together and have the alumni of CARD, or people who've never been to CARD but who just want to be in a group that loves them and that appreciates everything about autism. And the way to find out more information is to contact Joy Johnson. It's johnsonjoy@kennedykrieger.org. And there's lots of ways that families can help. I know that, people sometimes say to me, your organization is so large, and, Kenny Krieger's rich. And well, let me just say that we have lots of needs. And so financial and volunteer, there's so many things that we need help with. So please reach out if you want. Now, one of the things that every family counts on is that the thing that their doctor does for them, or the thing that their teacher does in the classroom, we want to know that it works. We don't want to waste our child's precious time and brain power on something that's not going to work. Plus, how many times have I had an idea and I presented it to a scientific group, and they always, they would say to me, Rebecca, cannot be done. And so we reached out, tried, and so that's why I say research is essential, and we learn from our parents, the parents of our youth. They tell us what they need, and then we go out there and try to innovate it. Now, let me just tell you that there's two ways that people can contribute to research. One is by doing nothing but come in for their clinical care, and one is by enrolling in a formal research project. Now, what happens in clinical research, that is, if you're a patient, when you come in, or when you go online and fill out your forms, you can indicate, there's two places on the intake form where you can consent to have your child's or your teen's clinical data be used for research purposes. And I want you to know two things about this. First of all, the clinical data for your child is secure, and it is kept in like Fort Knox. So even me as the director of the center, I can't go in and try to find a child's test results. Everything is confidential. If you consent to being available for research, your data are de-identified, and that is that your clinical identifier gets substituted. It has like a companion ID that identified, and then somebody who is authorized and has completed all the confidentiality training in the center may access those data to answer certain research questions. We don't even know how old, we don't know where people are from, none of these things exactly. There's like regional or geographic information that can be obtained. But as I say, this is highly confidential. And if you say that your data can be used for research purposes, nothing weird is going to happen to your data, and nothing weird is going to happen to you. And if you say no, it does not affect your clinical care at all. There's another thing that you can consent to, and that is that you can say that you can be contacted for future research opportunities. So let me give you an example. So I developed a screener for early social communication and play delays, and for autism. I'm going to tell you about it in a minute. So if you had a child in a certain age range, I could submit a request to the people who manage this and say, look for all the de-identified cases that are in this age range who have consented wanted to be contacted for future research opportunities. And then you would be sent a flyer. You're not going to get sent something on a frequent basis, so it's not like it's going to clog up your email. But I wanted you all to know about these options. Let me jump into research right now, and I'm going to focus right now on the early years. So many years ago, in the late 90s, I started to study the development of baby siblings of children with autism. And what I found was that 1 in 5 baby siblings of children with autism also developed autism. But what was really interesting was that I had always been taught when I was going through my training that autism was there since birth, and that a baby with autism would look like the baby had autism since forever. But as we were doing this work, we found that if you look at this graph shows actually receptive language raw scores from 6 months to 36 months. And there's 3 lines here. I'll explain what those are. The top line are children who we did not suspect of having autism at any point in their development between 6 months and 36 months. And this is their language growth curve. The babies in this middle line are babies who we didn't autism, but that they had language and or social delays. But at 36 months, they had autism. At the bottom line are babies who, when they got to 14 months, we thought they had autism. We were confident they had autism. And at 36 months, they did have autism. And so I'm showing you this slide for a couple of reasons. One reason is to explain that there's different developmental pathways to autism, and not every child is going to show really clear signs of autism before the second birthday. Every child is unique. I will tell you that I'm a very close collaborator with Dr. Joe Piven at UNC Chapel Hill, who has an international infant brain imaging study. And basically, what his brain imaging work has shown is that babies who go on to have autism at 24 months already show different patterns of brain connectivity at 6 months. So what's happening in autism is that your brain is changing before the symptoms appear. The same is true, for example, in Parkinson's disease. Like, your substantia nigra has already lost most of your dopamine receptors before you even go to the doctor. Before you even go to the doctor, because you're worried about symptoms. So this is complex. I can't go into more detail because of time, but I'm showing you this baby here, because one of the things that we did find is that 93% of the 6-month-olds who went on to have autism at 36 months had some form of head lag. I'm showing here a severe form of head lag, where when the baby is in a pull-to-sit task, the muscles around the neck are so weak that you have this kind of an appearance. But head lag ends in typical development at 4 months. So I want you to know that head lag at 6 months does not mean that you're going to have autism. I'm just saying that at 6 months, one of the big findings from our lab is that in babies who go on to have autism, there are very subtle motor differences. Some can be significant and some can be subtle. Another time I can tell you more about that if you're interested. Okay, now based on the work of we've done so much work with looking at how infants learn and develop. one of the things that happened was that families agreed to allow us to use their children's video to develop a 9-minute tutorial that's free. You can get it online, you can look at it, and it's called Bringing the Early Signs of Autism Spectrum Disorders into Focus. And I developed it for the American Academy of Pediatrics. But now I've been contacted by many, many governments across the world. It's been translated into many languages, and it's being used at many universities and medical schools in training physicians how to diagnose autism. And so there's that. Okay, now one of the other important things about early development is that a baby at 14 months, the way that babies are following other people's attention and the way that babies are initiating to get other people to look where they want people to look, as well as expressive language skills at 24 months, those things actually predict your social communication skills when you're between 8 and 12 years old. This publication thing in the bottom here is where we recently published these results. But based on your 36-month classification of having ASD or having social communication delays or none of the above, also showed your level of pragmatic language skill when you're between 8 and 12 years. So if you look on this graph and you see the bar graph that's the highest one, so a higher score on the pragmatic language scale is actually indicative of more pragmatic communication challenges. So those are the children who were diagnosed with ASD at 36 months. Whereas the lighter gray to the left of that are children who were not diagnosed with ASD at 36 months, but who were classified at 36 months as having a social and/or communication delay. And you can see that they have more elevated pragmatic language skill scores, meaning more difficulty in social communication than children who didn't have these diagnoses. Okay, I already told you about the infant intervention. Okay, I'll tell you real briefly about the screener. So based on the success of the 9-minute tutorial, I had it in the back of my mind that I should develop a screener for autism and social communication delays that would have video examples narrated so that families could look at them and understand what specifically about the child's behavior they should be looking at to help them decide whether or not to talk to someone about concerns about autism. And so I developed this tool, and what we found through the research, right now we have about 400 children, community samples and from our clinic. And right now this tool has 92% accuracy for classifying children with autism and who are between 12 and 36 months. There is no other tool out there that's this accurate. So we are continuing the research and to include children between 12 and 36 months about whom there are concerns and about whom there are no concerns, because we need a very diverse sample to really rigorously test the tool. All right, I want to say a few things about treatment and then I'll end. So intervention brains. And so the reason for this is because your biology is not enough to totally dictate how your brain develops. Brain develops through an interaction between experience and your biology. And so when a child has, through a child's experiences, different patterns of connectivity or connections. And this is called experience-dependent neuroplasticity. So we want to steer the kinds of things that kids look at. We want to steer the kinds of actions that children perform on objects. We want to steer the way the brain maps language by what words are said when the child's engaging with objects and people. And so in that way, we can try to corral the brain into a pattern of development that is not natural for a child whose brain has a propensity towards autism. I'm not talking here about eliminating autism. I'm talking here about helping the brain organize itself for the best possible outcome, so that if autism comes on the scene, that the best possible language skills are present, the best possible social skills are present, the best possible creativity emerges, because every individual has, the right to become their best self. Now, when a child is really young, it is critical to really jumpstart the language system, because language is one of the biggest predictors of adult functioning. And so what I've found through my research is that there's 5 key targets that don't function independently of each other in development, that actually bootstrap each other. And these are language, communication, joint attention, peer engagement, and object manipulation or play skills. And as we build these, we're really building school readiness skills. So in this graph, I hope you'll bear with me, I'm almost finished. You see the same 3 groups that you saw in the black lines earlier. The low line is how many times a child initiates an active communication to get someone else to look at or share or join in the topic of their attention, but they're not asking for like more bubbles or for a snack. They're actually initiating social communication. So between 14 and 24 months, the children who we thought had autism at 14 months really didn't do a whole lot of this initiation of joint attention. The group that we thought had a language or social delay, but not autism, which is the middle line here, black line, those children started off with some joint attention skills, but they didn't develop them any further before their 2nd birthday, and these children ended up with autism. The top black dotted line are the babies that we didn't think had autism, and you can see the rate of their development of joint attention. Now look at the green line. The green line are children who were in a 6-month intervention and then had a follow-up assessment 6 months later. So you're seeing them between basically 24 months and 36 months, their data. They came into an intervention study that's published that you can see down here on your screen. And we specifically, heavily targeted the things that you saw on the previous slide, and including joint attention. Look at the developmental trajectory of these children from the time they entered the treatment, which is right where the other children with autism were when they were 24 months. These children were mean aged, I think, like 26 months when they entered the study. And you can see that by the time they were 36 months, they were producing as many acts of joint attention as were seen at 24 months in typical kids. So this is just my way of saying that intervention helps. We all know that autism is very heterogeneous, and not every child is going to have an equal treatment response to other children. However, for all children except for those who are in an active regression, treatment makes a difference. So because this intervention has such potency, I sought funding and was awarded funding to adapt this intervention for use in public school classrooms, preschool classrooms, where it's implemented by public preschool teachers. We had sites in Maryland, Pennsylvania, Delaware, and Minnesota. And this is the website. It's earlyachievements.org. And so What we're trying to do is the study is now over, and now we have a study that we're doing to take this into childcare settings for young children. And we're going to be opening this fall telecoaching for teachers around the United States to train them how to do this intervention. This is just a slide just to show you the top lines of teachers using the evidence-based practices in their preschool classrooms with children with autism. And you can see that this was earlier on before we finished the study. We've had 75 teachers in each condition. No, I'm sorry, 35 teachers in each condition. And teachers who are trained in this, they attain fidelity. In other words, they learn how to do it. And their teaching turns out to be a lot better than teachers who don't get trained in this. And the outcomes of the children in their classroom are better than in classrooms of teachers who aren't using this treatment. So I'm going to close now, and I'm just going to say that we partner with families and organizations and policymakers to make a difference in the lives of those with autism and those that love them. Our work is pioneering, both in early detection, developing innovative interventions, including, I'm just going to mention a study that's being done by Dr. Roma Vasa, a child and adolescent psychiatrist, on anxiety in young children with autism and some of the anxiety interventions that are going on, as well as disseminating this work. And so, I welcome any and all of you to our team. So I'm going to end there and see what questions you all have.
Oh, wow, that's wonderful. Thank you so much. I've got a lot of questions, but folks, we're going to open it up. Go ahead, and if you have some questions for Dr. Landa, if you want to type them into the chat. And I had asked Dr. Landa a question, and I'll start us off. Just what are the biggest changes you've seen since you entered the field until now?
Oh my heavens, so many, it's hard to even count them. I think the one that's most to be celebrated is the concept of neurodiversity. And, thinking of people with autism as a part of the family of our community. I also think that there's a lot more to equip parents to assist their child in behavior regulation and development than there used to be, as well as the family centricness of interventions that take into account the well-being of the whole family. I just have to tell you a really quick example. Recently, one of our AAC experts was working on a child, working with the child on use of his augmentative communication system via telehealth. And the child, I think he's 8, and his 11-year-old brother came in and he said, "Can I play?" And so the speech pathologist said, "Absolutely." And so she modeled and mentored him through how to be in a conversation and reciprocal exchange with his 8-year-old brother using the AAC device. And the mom was in tears because it was the first time the brothers could really talk to each other. And so, that's just the kind of thing that I love. Another thing is that it used to be that we couldn't diagnose autism before 36 months. We didn't know that autism isn't evident in infancy, at least by mid-infancy. We didn't have the tools to understand what was happening in the brain and to know that autism is largely a disorder of disconnectivity of the brain. We didn't understand all the multiple systems that are affected in the body of individuals with autism. And, I know I need to stop there, but those are a few.
Thank you. That's terrific. We do have a couple questions. Can you say more about the chart with children? 3 and how? I'm not sure what this was asking. Hey, Erica, you want to unmute and ask the question?
Yeah. Hi, I was wondering, you mentioned there was a chart that showed children who were diagnosed at age 3, and it somehow was a predictor of how they were going to act when they were 10.
Oh, okay. Okay. You know what? I'm trying to get you back because I was trying to get to the full screen. How do I do that? Hold on a second. All right. All right. Can you guys still see me?
Yes.
Okay. I can't see you all right now, but okay. So Erica, I think you might be referring to the slide where I was talking about the pragmatic rating scale. Were you talking? Yes. And
We're not seeing the slide, Dr. Landa.
okay, let's see here.
If you want to share, where the share content again.
Okay, hold on. Sorry, I'm not really that great at this.
We are all learning.
Thank you for your patience. Okay, let's see here. Let's see.
There you go.
Oh, can you see it now?
Can see it now. Yep, there it is.
Let me go to that slide.
Perfect.
Okay, Erica, did you want to know about the pragmatic rating scale?
Yes, you were saying the children that were diagnosed at age 3, it was somehow a predictor of how they would behave at age 10.
Oh, okay. So a child's social and communication skills between 14 and 36 months are predictive of their social communication skills during adolescence. And the reason that I think that is so important is because those skills are things that we can work on. Oftentimes in early intervention, people are very concerned about teaching young children with autism facts. And I think, it's really key. Now, we have to bear in mind that every child with autism is different and each one has a very different temperament. And so there's lots of factors. So everything I'm saying right now is in generalities. But I think that one of the main take-home points about this slide is that we have to be really intentional, that as soon as a child starts to show signs of social or communication delay, for us to zero in on that and start to scaffold development in those skills.
Okay.
It's great for them to know their colors, numbers, shapes, and letters. And children with autism will learn those things. It's more important for a child, a 1 and a 2-year-old, and even a 3-year-old, to really be focusing heavily on knowing how people work and how they can understand other people's social cues and how they can engage other people socially. And the reason for that is because so much language is wrapped up in human interaction. And language is just a really critical part of development. And so much of schooling depends on language skill. Just one other word to the wise, and that is, I think sometimes we wait a little too long before jumping into the use of an augmentative communication system for a child who's not speaking. When we use AAC, it does not prohibit speech development. And I was recently working with an 18-month-old who was just not getting any words out and started to use some visual, sort of a rendition of text. And it was really effective in helping her make the connection between that concept and that her little mouth could make some sounds and approximate that word. So these are powerful tools that we don't always exactly know how or why they work, but can be very supportive of children's development early.
Oh, that's great. Thank you. We have another question. How can we be sure that our child is receiving the right treatment for ASD? We have no basis of comparison, so it's difficult to ascertain if we are providing optimal intervention or should be seeking additional therapy.
Understand. Okay, so the treatment that is the preferred intervention right now, based on the evidence base, is called naturalistic developmental behavioral intervention, or NDBI. And the reason that this is so powerful is because it blends together the applied behavior analysis sciences and the developmental sciences. And so if your child is getting ABA, more than likely the therapist who's delivering that is using the primary principles of ABA. Whether or not they're using developmental principles as well is hard to know because the NDBIs kind of haven't worked their way out into everyday practice very much yet. So I would say, depending on your child's age, the key elements to look for are that the intervention is blending the applied behavior analysis strategies of delivering clear and developmentally appropriate cues so that your child knows what is being expected of him or her, and that the behaviors that are being sought from your child are things that are developmentally appropriate. They're not too hard for your child, they're not too easy. And then that there are natural rewards. So it is sometimes necessary to use artificial rewards like food, but more developmentally appropriate is to use things that are situationally relevant. Like if the child asks for a car, they get the car instead of an M&M or something like that. And that also there's a prompt hierarchy using a least to most prompts. And that into all of this intervention, it is happening in a meaningful, playful, but structured or semi-structured interaction context.
This is an important question. We're certainly, all the young children that we all saw come through and be diagnosed, we're just seeing more kids who are transitioning into adulthood. And so the question is, does CARD provide services to young adults over 18 and under 23?
Yeah. So we do. The issue that we have, in fact, we were just on the phone today talking about this, is, even though we have 179 staff and 3 sites, it's still not enough. And so we do have providers who see young adults. We're working very closely with Bayview. There is an adult psychiatrist there, Dr. Elizabeth Wise, who is really tremendous. And we are, trying to support her. Her team is very small, so that she can build an adult care system at Bayview Hospital. I know that it's really far from you all. But yes, this is an ongoing and nagging problem.
We do get a lot of calls looking for diagnoses for adults, and I've had folks come to me, in their 50s and 60s, and it is hard to find enough resources for adults. So that's good to know she's building that. The next question is, can you talk about older girls, 8 to 10-year-old girls?
Mm-hmm. So, this is an area of active research, trying to understand how autism is affecting young women differently than young men. And so there's so many unknowns about this, but it does seem that in young women, girls this age, that the symptoms can be masked or not as readily recognized by professionals because sometimes the way those symptoms are manifesting in the girls are not as overt as in males. Is there something more specific that?
I'm not sure who answered this or who asked this question. If you asked that question about girls, if you want to unmute and elaborate, that would be fine. It says G821. I don't know who that is. No, maybe somebody hopped off. I don't see them right now. You know, and we just started a young women's group right before COVID because it is very different, and a lot of the girls are not, and women, you know, aren't diagnosed until later, and have some unique needs, and I think it's just a very different question, and I think we've all heard that there are probably more, girls, young women out there who are undiagnosed, and
Yeah, and one of the biggest concerns about them is self-image and their self-efficacy. And, this is extremely concerning because it's often related to anxiety and depression. And, I really worry about them. They need to know that they're valued and they're valuable, and how to, because sometimes it's really hard for girls because of the way other girls can bully them. And, they don't have the experience to know how to address these experiences where they're feeling rejected. And so, yes, I mean, they really need support.
thank you. When do you transition from ABA to social skills groups?
Well, so I'm of the school of thought that all good intervention has these principles of learning embedded in them. And so these ABA principles should always be being used in ways that are adapted to the needs of the individual. So, a lot of times people think about the implementation of ABA principles going from the most explicit instruction of discrete trial training in the Lavoisian method, all the way to like floor time, doesn't have really the obvious manifestations of ABA, but so the point is that social skills should always be a part of intervention for autism. And again, the way that gets done in an NDVI intervention is that, let's just say that you're playing with a toy. You're going to want to choose toys that have multiple parts or multiple toys that can be used together so that two people can be playing with them simultaneously. And so what you do in those play situations is that you try to relate your play to the child's play, and then you want to expand that and add in opportunities for the child to imitate you or adapt the child's behavior to you, and to use language that's related to your actions, and to build in these joint attention features. So these things are the early versions of social skills. You can start social skills training in 1-year-olds. In other words, we have groups for 1-year-olds where parents and their child come together in small groups, and at first the children don't engage with each other, but before it's over, they're washing the table together, they're imitating playing with the rubber ducks. They're, you know, that kind of thing. So, but I think the way most people are thinking about social skills in the formal way, probably think about that at entry to school age. But I just really would caution people to encourage their interventionists to be supporting group intervention during the preschool years at the latest.
Thank you. Other questions, folks, that you might have? Folks that haven't asked a question. And I know we're all wondering, we're all really excited about that 2021 date. Because so that would be right on the campus, right? Right near the building there in Columbia?
Yes. So you know which one I'm talking about that has the Kennedy Krieger? Yeah.
Yeah, right. Well, we're right on that campus. Right across the parking lot. And in fact, right before COVID, we were working on a drone picture with the staff there for Autism Awareness Month, which of course didn't happen. But it's a great place, and all the county agencies are there, and just a really good space. And we're really so excited that you'll be coming to Columbia, and everybody will be very excited not to be doing that drive. So
we won't have physicians in that building, but the physicians, psychiatrists. So anybody who needs the psychiatric care would have to come to Green Spring or to the downtown office.
Okay. All right. Well, we're glad that whatever, just way you can get down there, that would be great. We do have a couple more questions. What interventions do you recommend for a 13-year-old who is mid to high functioning?
Well, I would say that if that 13-year-old can get into one of the club treatments this summer, it would be awesome. If not, definitely sign up now for next summer. Those are so cool and so much fun, and they really build literacy and social and problem-solving skills. I think that, you know, definitely getting involved in one of the social skills groups is always good, because sometimes the youth that are in these groups, they stay friends for a very long time. And I just love that. And one day I happened to walk into our little cafe that we have, and one guy walked in there and he looked at his watch and he said, "Am I in the right place at the right time?" And one of the other young men said, "I think you are." And then they had this huge conversation about why isn't anybody else here? And I thought, you know, these guys are mates. They're good friends, and they're commiserating together on why everybody else is behind the 8 ball. And anyway, the whole thing was just, I just loved it. But yeah, so those are some interventions. Now, if there are other issues around behavior dysregulation or social emotional problems, well then, or anxiety, then some of the interventions might center around cognitive behavioral therapy or some mindfulness techniques. Dr. Amy Kiefer is one of our interventionists who specialize in those things.
Thank you. This is just a nice comment. My child has been utilizing card services for 15 years, and I feel so very fortunate. She's come a long way. So thank you.
Thank you.
And this, I believe, this was the question back from the person who asked about diagnosing girls. I have a very friendly 9-year-old daughter who has lots of struggles similar to ASD girls. Any suggestions on getting older girls diagnosed? So that's a more complete question, I think.
You know, okay. The thing I would suggest to you to do, get on the internet and look at the Diagnostic and Statistical Manual, the DSM-5 criteria for ASD. and start to make a list of the things that you see in your 9-year-old that could match up with those diagnostic indicators. And so that when you see the psychologist or the physician, and that you can explain, because those appointments with the psychologist or the physician, they're short. They're not, the doctor's not going to get to see everything. And make sure that you put down concrete examples. Now, there is evidence that the characteristics of autism are distributed throughout the general population. So, everyone has something to some degree that's related to some of the autism characteristics. And so where does one draw that line? Where does that line in the sand get drawn between autism and not autism? And sometimes an individual, let's just take this 9-year-old, mom might take her to see a professional, and the professional might say she falls short of the diagnostic criteria for autism. And the mom might say, yes, but her social communication is impaired. She has difficulty with friends, making friends and keeping friends. She's very rigid in her thinking. She really likes things to be the same. She has difficulty understanding innuendo, making inferences or understanding humor. What I would say is that sometimes it doesn't matter what the diagnosis is. We have to treat the challenges that the individual has. So as the mom and dad work on getting an appointment and going through the diagnostic process, I would definitely be working with the school, including the school psychologist and the school speech pathologist, and making sure that the proper evaluations are done at school to make sure that the teacher is giving the proper supports and that this gal is getting the right kind of speech and language supports. Because sometimes if their language skills are intact, they won't qualify for speech and language services, even if they have those social pragmatic problems. Those social pragmatic problems should qualify them for speech and language therapy.
That's great. Thank you very much. Thank you very much. Any other questions, folks, that we have for Dr. Landa? The post in the chat. All right. Great. Well, I think then we might just wrap up here tonight. Thank you so much, everybody, for being with us. From all of us at the Autism Society. Check out all of our activities and resources. We have lots of things coming up online. Star Wars Trivia Friday night. There's still some openings if you're interested, and support groups. And I'd like to thank Dr. Landa for being with us. I know I learned a lot this evening, and just great to hear all that's going on at CARD and to learn more about that wonderful resource in our area. So thank you very, very much, and have a good evening, everybody. And we'll be posting the PowerPoint, and Suzanne will be sending to all of you who registered, so you'll get a copy. So,
thank you so much, everyone, for your
very much. Have a good night.
Take care. Bye-bye.
Good night.